He died because he couldn't afford to live. That was the story of Jesse Lutkin, an American man who passed away in 2018 because he had lost his job and could no longer afford the insulin he needed for survival. And he is far from the only one. It's estimated that over 1 million diabetic Americans ration their insulin due to high costs, leading to all kinds of complications, and sadly, in some cases, the worst happens. And while that story might sound shocking, you should also know that among those living with other conditions, according to the American Journal of Medicine, 45,000 Americans die annually from lack of health insurance. Meanwhile, 4,000 miles away in the UK, a diabetic man like Jesse could pick up their insulin prescription for a cost of £0. The most he needs to pay is the bus ticket or petrol money to go pick it up. Which brings up the question, is healthcare a consumer commodity or a human right? It all depends on where you live. As an American living in the UK, I'm always aware of the British and American differences in our cultures, and healthcare is no different. In 1945, the world was rebuilding after one of the most devastating wars in human history. Two allied nations, both exhausted from years of conflict, faced the same question. How do we take care of our people? Britain's answer came from a man named Aneurin Bevan, the son of a Welsh coal miner who became Minister of Health. On July 5th, 1948, he launched the National Health Service. And his words would echo through history. No society can legitimately call itself civilized if a sick person is denied medical aid because of lack of means. The NHS was built on 3 revolutionary principles: healthcare free at the point of use, being funded through taxation, and available to all residents regardless of their ability to pay. It was, Bevan said, the envy of the world. America's path was different. During World War II, wage controls prevented employers from offering higher salaries to attract workers, so they offered perks like health insurance instead. When the war ended, this temporary measure became permanent, creating the employer-based insurance system that would trap Americans in what economist Paul Starr called the social transformation of American medicine. Fast forward to 2025, and the results of the two choices are pretty stark. Americans spend about $12,914 per person annually on healthcare. The UK spends an equivalent of $5,387. Americans pay 240% more for healthcare than their British counterparts. And despite spending more than twice as much, Americans die younger. Life expectancy in the US is around 78.4 years compared to the UK at around 81.2 years. American infant mortality is around 5.6 deaths per 1,000 births. The UK's is lower at around 4.1. And when it comes to access, the Commonwealth Fund's 2023 international survey found that 33% of Americans skipped necessary medical care due to cost. Compare that with just 7% of UK residents saying the same. And here's where the numbers become truly hard to grasp. According to an American Journal of Public Health, 66% of personal bankruptcy in America are tied to medical issues. In the UK, medical bankruptcy is so rare they don't even track it as a separate category. Dr. Adam Gaffney of Harvard Medical School published research showing that Americans delay or forego medical care at rates 5 to 10 times higher than residents of countries with universal healthcare. The result is preventable deaths that occur nowhere else in the developed world. Take something like diabetic ketoacidosis. This is a preventable complication of diabetes that occurs when patients can't afford insulin. In the UK, this condition is virtually unheard of outside of new diagnoses or a medical emergency. In America, it kills around 1,500 people per year, according to the CDC. And this is almost entirely due to them rationing their insulin because they cannot afford it. And here's something else you need to know about American healthcare history. We almost chose differently. In 1945, President Harry Truman proposed a national health insurance system very similar to what Britain was building. The health of American children, like their education, should be recognized as a definite public responsibility, he said to Congress. But there was an organization called the American Medical Association, and at the time, they spent $1.5 million, equivalent to about $20 million today, on a campaign to defeat Truman's plan. They hired an advertising firm to convince Americans that national health insurance was socialized medicine and therefore un-American. And they succeeded. Dr. Paul Starr's Pulitzer Prize-winning book, The Social Transformation of American Medicine, documents how organized medicine deliberately chose profit over patients, creating what he called a triumph of accommodationism, a system designed to enrich providers rather than improve health. Now let me walk you through what happens when you need medical care in both countries, because the differences in how these systems actually functions reveal pretty much everything. In America, your health insurance is essentially a contract between you, typically your employer, and a private company whose primary obligation is to their shareholders, not to you. Firstly, you choose a plan during what's called open enrollment, assuming your employer offers choices. Many do not. Each plan has a network of approved providers. If you see someone outside this network, you're likely to pay full price or get very limited coverage. Now, your plan comes with what's known as a deductible. This is the amount you pay before insurance kicks in, which can range anywhere from $500 to $8,000 for high deductible plans. If you're self-employed, like I am, and health insurance is not available through your employer because you are your employer, then you go to what's known as the health insurance marketplace to choose your plan. Monthly costs for this range around $500 to $1,200 per person to have coverage. And this is just to have coverage. This doesn't include the deductible that we've talked about that you have to pay when you actually access the care. For many self-employed, this is unaffordable, and you'll find many people who openly state that they do not and cannot afford it and simply take their chance without insurance. As a self-employed person here in the UK, this is one of the main reasons why I'm not planning to move back to the US anytime soon. Anyway, when you do need care in America, the complexity begins. Your doctor's office checks your insurance eligibility, determines what's covered under your specific plan, and often requires prior authorization for anything beyond basic services. Prior authorization means that your insurance company actually reviews whether they think you need the treatment that your doctor's recommending. A person who has never even met you working for the insurance company gets to override your doctor's medical judgment. After you receive care, your doctor's office submits your claim to your insurance company, who then decides how much they'll actually pay. You might receive multiple bills, one from the doctor, one from the lab that processed your blood work, one from the radiologist who read your x-ray, and possibly one from an assistant surgeon you've never even met. Each of these providers also might be on different insurance networks. Your insurance company then processes these claims and sends you an explanation of benefits that's intentionally confusing and tells you how much you owe. You're responsible for co-pays, co-insurance, deductibles, and anything the insurance company decides wasn't medically necessary, even if your doctor thought it was. Now, the NHS doesn't have insurance in the American sense. It's more like a public utility funded through general taxation, and here's how it actually works. You register with a local GP practice when you move to an area. That's it. There's no enrollment periods, no choosing between plans, no network restrictions. Your NHS number follows you for life, like an American Social Security number. And when you need care, you contact your GP practice directly. No insurance cards to show, no eligibility checks, no prior authorizations. Your GP can refer you to specialists, order tests, or prescribe medications without checking with an insurance company. And after you receive care, there are no bills to pay except for prescription charges. There's no claims to file. The providers are paid for directly by the NHS through block funding and fee-for-service arrangements that patients never see. And the difference in administrative complexity is staggering. American doctors' offices employ armies of billing specialists, insurance coordinators, and claims processors. A typical American medical practice spends about 25% of its revenue on administrative costs related to insurance. British GP practices don't need billing departments because they don't bill patients. They don't need prior authorization specialists because most decisions are made by the doctors, not insurance companies. Now, the prior authorization problem is a significant one, and it requires more of our attention because it's uniquely American and uniquely frustrating. Prior authorization requires doctors to get insurance company approval before providing many treatments, tests, or medications. And the process works like this. Your doctor determines that you need an MRI. Instead of simply ordering it, they might have to call your insurance company, provide medical justification, and wait for a review. Often, people can spend hours on phone calls with insurance representatives for more complex treatments who may not have had any medical training. About 35% of prior authorization requests are denied, forcing doctors to spend even more time appealing. The system exists purely to create friction and delay care in hopes that patients will give up or find cheaper alternatives. alternatives. NHS uses prior authorization very rarely and mainly for exceptionally expensive and unique treatments that require very specialist evaluation. Again, most medical decisions are left to doctors and patients without insurance company interference. And emergency care reveals another fundamental difference between the systems. In America, emergency rooms are required by law to treat patients regardless of insurance status, but this doesn't protect patients from massive bills later. Even if you have insurance, you might end up at an out-of-network hospital during an emergency, leading to what's known as balance billing. This is where the hospital charges you the difference between what your insurance pays and what they normally charge. You can receive emergency care and then face bankruptcy from the bills required. In the UK, emergency care through A&E departments is simply free for everyone with no billing, no network issues, and no financial consequences regardless of your ability to pay. And when it comes to prescriptions, American insurance plans each have their own formulary. This is a list of covered medications. Even if your doctor prescribes a specific medication, your insurance might not cover it, or they might require you to try alternatives first. Formularies change annually, so a medication covered this year that you take might not be covered next year. The result is that American patients often can't get the exact medication their doctor prescribed and must either pay full price or try alternatives that might not work as well for their condition. The NHS is a single national formulary. Your GP can prescribe any approved medication and you pay the standard prescription cost regardless of the medication's actual cost. And speaking of prescriptions, let me give you some staggering numbers. Insulin, discovered in 1922, is required for diabetics to survive, and in England, patients receive this drug for free. In America, that same vial costs an average of $100 monthly, sometimes less depending on your insurance and sometimes far more. But in America, the thought of a patient receiving a life-saving medication at no cost to them, unheard of. In the UK, prescription costs are straightforward to the point of being boring. Every prescription in England costs £9.90, whether it's a £5 antibiotic or a £5,000 cancer medication. The NHS negotiates prices with pharmaceutical companies for the entire country, but patients never see these negotiations or pay these prices. If you need multiple medications on the NHS, you can buy what's known as a prescription prepayment certificate for just over £100 annually, and this covers unlimited prescriptions. For comparison, Americans with chronic conditions often pay more than that per month for their medications. And certain groups in England get free prescriptions. Anyone under 16 or over 60, pregnant women, people with specific chronic conditions like diabetes or epilepsy, and those receiving certain government benefits. Now let's look at some specific medications to see how dramatic these differences really are. Let's talk about an asthma inhaler. In America, this could cost $300 to $400 with typical insurance company. Through the NHS, it's £9.90. Then there's drugs for rheumatoid arthritis. American patients typically pay $500 to $2,000 monthly depending on their insurance. English patients pay £9.90, and since rheumatoid arthritis is listed as one of the conditions that gives patients free prescriptions, then their medication is free. Then there's cancer treatments, where Americans might pay thousands monthly out of pocket even with insurance. British patients pay nothing, as cancer medications are free through the NHS. And then there's something like an EpiPen that you might need for allergies. A 2-pack can cost Americans around $600 to $700. British patients pay £9.90 for the same product. Now, pharmaceutical companies often argue that high American drug prices fund research and development for new medications. There's some truth to this, but it's more complicated than industry advocates would have you believe. Much basic pharmaceutical research is funded by government agencies like the NIH. Many breakthrough medications originate from university research funded by taxpayers. The pharmaceutical industry does fund clinical trials and drug development, but they also spend more on marketing than research. And countries like the UK with negotiated drug pricing still see robust pharmaceutical innovation. British companies like GlaxoSmithKline and AstraZeneca are major pharmaceutical innovators despite operating in a price-controlled environment. And American insurance networks are perhaps one of the most consumer-hostile aspects of the entire system. Your insurance company negotiates rates with specific providers, and you must use those providers to get full coverage. But networks change constantly. A doctor who's in-network when you start treatment might be out-of-network when you finish. The hospital might be in-network, but the radiologist working there might not be, leading to surprise bills for services that you had no choice about. The system exists because it gives insurance companies leverage to negotiate lower rates with providers, but it restricts patient choice and creates constant uncertainty about coverage. Insurance companies often pay different amounts to different providers for the same service, and these payment rates are considered trade secrets. Patients often have no way of knowing in advance what they'll owe, even for routine procedures. And here's the lie that some Americans tell themselves to justify this system. We pay more, they say, but we get better care. And that's not exactly true. The Commonwealth Fund's 2023 study put the UK 4th out of 11th developed nations when it comes to healthcare performance. America ranked last, 11th out of 11, despite spending twice as much per capita. And let's talk about what the system does to children, because the data is particularly devastating here. Georgetown University Health Policy Institute found that 4.4 million children lack health insurance in America, and another 15.7 million have inadequate coverage. These children are 70% more likely to have unmet medical needs and 60% more likely to be hospitalized for preventable conditions. In the UK, child poverty exists, but healthcare poverty doesn't. Every child receives comprehensive healthcare through the NHS regardless of their family's economic circumstances. The result is that the UK has a lower infant mortality rate, higher vaccination rates, and better childhood health outcomes than the US, according to UNICEF data. So why? Why aren't all Americans up in arms about the health insurance system demanding change? Well, many are, to be clear, but there are a few factors at play. Firstly, there are a lot of talking points in the US about the downsides of nationalized healthcare. And some are true. From experience, yes, I can say that the quality of the actual physical healthcare buildings like doctors' offices and hospitals are far newer and flashier and sleeker looking in America. Obviously, the NHS is making sure that the patients are taken care of over repainting the hallways, and it can show depending on the building. I also have always had to ensure that I'm advocating for myself even more in an NHS-driven system because decisions can be made a bit more conservatively rather than throwing all the scans and all the tests at you like in the US. And waiting times for non-emergency procedures can take a long time, that is also true. So people will point to these things and write off the entire system. When in fact, whether or not the hallway has been repainted does not impact patient care, and when you have an emergency in the UK or a procedure that needs to be done quickly to save your life, the NHS fast tracks you to ensure that this happens. Secondly, a lot of companies have a lot to gain from the current American healthcare system. Pharmaceutical companies, lobbyists, insurance companies, for-profit hospitals and doctors, and the list goes on. America is run by corporations. It was built that way. It's by design, and it's no different in this space. It would take huge overhaul forced by the government to make changes, and often the government parties are the ones listening to and being driven by these lobbyists and corporations with big power and money. And finally, you can say, but this all still sounds insane. Americans declaring medical bankruptcy, dying because they couldn't afford insulin, and yes, it does, but you can grow accustomed to almost anything when that is the situation that you are in. My worldviews and understanding of how other countries operate has changed significantly since moving to another country. I can't say that if I had stayed in America, I would have been exposed to or drawn to researching how it works for other countries, which is why you see so many of those American Reacts channels or Americans acting surprised when they learn that an ambulance ride doesn't cost a British person anything. You live in your own bubble, learn to tolerate the conditions you're in, and you feel like you as an individual person don't have the capacity to make a change anyway, besides trying to find an employer with a good healthcare plan. Now, this video doesn't have a hopeful message to end on. I don't have the answers, but if you're in the UK and you haven't been thankful for the options the NHS provides you, probably now's the time. As always, thanks very much for watching, and I'll see you next time.